So let's get started. The speed of this spread is quite something. Countries are ramping up their response, their restrictions, social distancing, self-isolation. Jake, is that the right approach, do you think?
So the World Health Organization has already said that this is a public health emergency of international concern. They recently said that it's characterized as a pandemic. That just means that it's in a lot of countries around the world now. So this is a serious situation. Countries do need to focus on their efforts to try and slow down the spread, limit the spread of infection.
I just want to put onto our screen a graph that's gone viral in recent days because it's a really good visual illustration of what the strategy is for governments. There you see that spike on the left-hand side. That is if no restrictions are in place. And what governments are trying to do is to flatten that line, the yellow line, because the horizontal line that goes across the screen is the key one. That is whether health systems have the capacity to cope with the numbers of infections. So that is the strategy, to avoid that big peak and to flatten it down, spread out the number of cases over the timeline. Now, Catherine, we keep being told politicians are following the science, but there are political decisions and political choices in this because different governments are making different choices on things like public gatherings, on sporting events, on school closures.
Yeah, and the science doesn't change that much. The decisions for each country does. So we know that every country around the world is trying to do the same thing. They're trying to, as you said, flatten that peak, spread out the cases, slow it down and delay it. But it's a balancing act because at the same time, they're trying to figure out the sort of impacts of that on their country, on their economies, on people's lives, on people's mental health even, being isolated for so long. That's the balancing act, and each country is coming to different decisions.
Well, stay with me because a lot of pretty basic questions around self-isolation. Here's our medical correspondent, Fergus Walsh. Have a look at this.
If you're told to self-isolate, that means staying at home, not going to work, school or other public places. You shouldn't have any visitors. If you develop symptoms, a fever or cough, then seek advice first by phone. Don't just turn up at a medical centre or hospital. If you live with others, then you need to stay in a well-ventilated bedroom with the door shut. If you have to share a bathroom, then use it after everyone else. Don't share towels and toiletries. Your waste should be double bagged. If you test positive, it'll be separately disposed of. If you live on your own, you can order shopping online or get friends to help, but they should leave it on the doorstep. The coronavirus causes a mild illness for 4 out of 5 people. Self-isolating will help protect older people and those with underlying health problems from getting infected.
So that's self-isolation. What is life in lockdown like, though? This is how one family who don't have symptoms are actually coping with those massive government restrictions now in place in Italy. Have a look.
She's my sister, Margherita.
Hi. For me, it's a new experience and miss a lot my friends. But my teacher, Simonetta, set up a distance learning platform for study.
This is my dad. Hi.
Hi. It was quite difficult and challenging at first time, but we did it. In a couple of days, we're all adapting to smart working, and I think it's a big kickoff in balancing work life and family life. It's tough, but we did it.
Well, a little snapshot filmed there on a mobile phone, which takes me nicely to a question from Linda on Twitter, who asks, as we touch our mobiles all the time, how and how often should we actually clean our mobiles? Catherine, take that question.
So, Linda, the advice on this is actually quite surprising because if you think of how many people touch your mobile phone, generally it's just you. So, yes, you could shred the virus onto it, But because not many other people touch it, it's not too much of a risk. But still, actually, some smartphone manufacturers have actually changed their advice. So generally, if you think the advice has always been clean it with a lint cloth, now they're saying, yeah, you can use some antibiotic wipes. Try not to get them wet, though.
And in terms of more general advice, in terms of hard surfaces, soft surfaces, public transport?
So hard surfaces, let's say, for example, I sneezed right now and the droplets would be in the air. They would land on the desk, on the phone. You're not going to get them from touching it, but they would be there and they would slowly, the germs would slowly disintegrate over essentially up to 72 hours. So this is why it's so important to wash your hands, because if you then touch those surfaces and then touched your eyes, your nose, your mouth, you'd be bringing the germs in. So, for example, on public transport, it's use your common sense. Wash your hands when you're finished. Try and keep away from people. If someone's sneezing, get in the next carriage.
Catherine, thanks very much. We saw just a snapshot from Italy. The biggest outbreak outside of China, of course, is Italy. And many of you have actually been asking why. Well, here's Lewis.
Italy's government locked down the whole country on Monday, and this graph tells us why. The virus is spreading at speed. Late February, there were a couple of hundred new cases being reported each day. Within 10 days, it was 10 times that. And the mortality rate appears to be higher than the global average. So let's compare that to, say, South Korea, which also has a large number of cases, but where there are far fewer deaths. And let's take a look at this map, which shows the infection rate slowing, which begs the question, why the difference? Well, first is the rate of testing. And we can look at this graph by Business Insider. Compares 8 countries. It shows that as of the 8th of March, South Korea was doing almost 4,000 tests per million people. Italy was testing 826 per million people. Now, fewer tests mean milder cases going undetected. And that means a lower overall number of cases, which in turn pushes the mortality rate up. So Italy's number of cases may be higher than we think, and the mortality rate may be lower. The second factor is that Italy has the second oldest population in the world. 23% of the population is over 65. And we know that older people are much more vulnerable to this virus. Now, the third factor is timing. February is peak flu season, which means earlier cases were missed. And we can take a look at this quote from one infectious disease expert in Italy saying that this started unnoticed, which means by the time we realised it, there were a lot of transmission chains happening. Now, if we go back to Italy and look at the fourth factor, which is population density in northern Italy. With so many ill people within a particular region, you get higher rates of infection and then greater pressure on hospital resources. So what began there as a concern in February is now a national crisis. It's being watched with apprehension by people across Europe.